We conducted a very extensive and very comprehensive study in Delhi, for example, where we sort of did the several measurements. And once you have the measurements, then what you do is the measurement, then you have the complete chemical composition of the particles, where like for example, suppose the calcium, for example. So calcium comes from the construction activity, for example. So there are the fingerprints for each sources that we have. So we compare the levels what we receive at the receptor level vis-a-vis the fingerprints at the source. So essentially we know which source has come to the receptor location, and with this with little bit of mathematics which sort of we work out that which sources. So in Delhi we could clearly say that was the biomass burning was a major contribution to the air quality. Vehicles came at the second level, and the third, which sort of a little bit technical issue, are the secondary pollutants, which were sort of they start with the emission as a gases, but in the atmosphere, because of the photochemistry, they turn into the particles and they eventually reach the receptor, as I've been trying to define. And these receptors, the secondary particles, are because of the precursor gases actually. So they had a major contribution at a place like Delhi. And third thing is the waste management sort of also contributed to the air pollution, especially the burning of municipal solid waste. So once we identify these things, then you can work out the various options and action plans, and you can look at the various options, what are the options are there. You also need to look at the efficacy of those options, and then work out a plan, of course, have the budgetary provisions for that one, and make sure that the programs and the plans are implemented, and make sure that the air quality standards, which every nation has its own standard, are achieved. And there would be definitely health benefits if we have achieved those standards, and it gives a great advantage to the. And last point I would like to say is that if you really work out, which we did partly, the cost benefit analysis, and the cost of the pollution control would always be much less than the cost of treating the the patients and people suffering because of the air pollution. So there's always a situation where the cost benefit analysis goes by and large in favor of the pollution control.